Thank you very, very much, Jill. As I said, we're really, really grateful for the continued support of the department. And I know I speak on behalf of many of us in the room, the leadership from both state and federal government in this space. We can really see that translating on the ground here in Victoria, and I think we all consider ourselves very lucky. So thank you. All right, I'm so sorry, but now I'm the one person holding us between us and our plenary, but I promise I won't take too much time this morning. So I'm just going to take a little bit of time to share some of the successes of SERT over the last 2 years, as well as I'm really excited to be able to soft launch our new strategic plan for 2026 to 2031. So at SERT, partnership is at the heart of everything we do, and quite simply, our work would not be possible without it. So every achievement I'm going to highlight today has really only been made possible due to the strength of the collaborations we share across Victoria. So therefore, to our partners, a massive thank you. These are most definitely shared successes, and we're really proud to be able to showcase them and celebrate them with you. So to kick us off, I just firstly wanted to touch on how we're working towards building the future workforce. So these are our intake numbers across our sexual health, across clinical context, medical discovery subject. So here as part of the University of Melbourne medical degree. As you can see, we commenced in 2022 and have now worked our way to 2025, where we take 3 year levels. So it's safe to say the team have been incredibly busy over 2024 and 2025. We're really proud to say that this is one of the most popular subjects in the Discovery Unit. And when we think about our future workforce, it's really great to see that we've got young medical students interested in sexual health from a really early kind of part of their career. So we get around 14% of the entire first year cohort applying for this subject. There's only one other that kind of gets that intake, and that's death and dying. So we're pretty proud of that. Again, another hard subject, I know, total opposite subjects, but another really hard topic to talk about. And we know that the students want to learn how to have these hard conversations. So when they're expected to do it in that room and they're meant to be the experts, they can do it with confidence. Something we're also really proud of over the last 12 months is our ability to maintain our face-to-face delivery with our rural students here at Shepparton campus. In an environment that's really tight, we are being pushed to more centralisation and online delivery, but we have structured our subject to be able to still receive face-to-face delivery here for our Shepparton students. And for us, that's really about equity and access, right from the beginning of these rural med students' career. So it's all well and good for me to tell you the impact we're making, but a little bit of data to back it up. So here you can see the pre-communication tutorials confidence around taking a sexual health history and the students' post-communication tutorials confidence. So as you can see, you could almost flip these charts on their head, and I promise you this is absolutely not by chance. The team place a really strong focus on supporting students to build their communication skills. So how to have sensitive conversations that are respectful, and really emphasising that every interaction with a patient is an opportunity to build trust and dignity. Because we know some of the lived experiences of these people, they may never have received that opportunity to have that reflected, that this is your story and you should have respect and dignity shown to you. It's also role modelled in the way the teachers provide the content. So there's no dumb question, they make sure there's no judgment, and they ask with curiosity when the students raise a query. And ideally this is role modelling this kind of behaviour from the leaders so they can then apply this in their clinical setting. We're also really proud to say that we get some really great feedback from our placement providers, and shout out to anyone in the room that takes our students. It's a massive help, and the students get a lot out of it. But the placement providers always commend us on the professionalism of our students and the way they engage with patients. So it's wonderful to see that whilst this is just on a survey report, yes, I'm confident, you can actually see it translating into the way they engage with patients. A little bit of feedback from the MD3 students. I won't read through all that, but it really just showcased some of the things that they really appreciate around the way we deliver the subject. So of course, this won't be a surprise, the practical skills. So they get exposed to hands-on learning in implant-on insertions, and here are some of our rural champions, so regionally based students. I'm very proud of their implant-on certification. IUDs. And something that's worth noting that is unique to this subject is the students do get an opportunity to conduct a vulval examination, which is actually quite unique. Unfortunately, it's unique, but we know it's really important to get more exposure and confidence to do this in a sensitive way. So again, once they hit the ground running, they feel confident to provide this care. Now, we do have a panel from the students tomorrow, so we'll be able to ask them questions directly. And we've also got what's called a Shack Shack. It's our showcase of all the students' feedback and assignments if you do want to learn more about what the med students that are our future workforce are learning and the assignments they're doing. Another piece of work that's taken up a significant amount of our time, but we're really proud of, particularly Carly March, shout out, is our Rural Services Development Project. So the aim of this project is to really support our rural service providers to be sustainable. That's mammoth. But we're really proud to have launched these 3 resources which are helping move towards that sustainability. So the Working Towards Sustainability Report Practice Manager Guide. This outlines a range of strategies to help improve financial viability and process efficiencies in the clinic, because any opportunity to increase efficiencies means more time given back to our workforce. So if there's any admin, anything we can do to support there, it just increases that opportunity for viability. Alongside that, we've developed our MBS guide. This really is a cheat sheet of all the SRH MBS opportunities. Most important for us is this is a living document. So as new MBS items become available, we are regularly updating this. So we know that endometriosis, there will be a number of items that become available. So our providers don't have to spend the time unpicking, understanding this. We're doing the homework for you and trying to make it easy and accessible, just to make it more enticing for services to provide sexual and reproductive health. And most recently, we launched our Rural Sexual and Reproductive Health Skills Training Guide. This is an overview of all the accessible trainings and their costs for an aspiring professional wanting to build skills in sexual and reproductive health care. Because there's lots of different providers, lots of different pathways you can take. This just puts it all into one place. And as I mentioned, a lot of our work is in partnership. So this is our partnership and collaboration slide. We're really proud to now coordinate 6 communities of practice across Loddon, Mallee and Hume, each underpinned by a plan, a localised developed plan. Our Sexual Wellness Development Series continues to grow in engagement, and shout out to our speaker next month from Sexual Health Victoria. That'll be a fantastic presentation on online safety. You'll see there Men's Sexual Health Clinic. We're really proud to be able to support a pilot of a men's sexual health clinic in Swan Hill, led by nurse practitioner Holly, who is going to present on this later in the conference. Another key partnership I wanted to highlight was our work with Multicultural Health and Support Services. So we most recently finished a Northwest Roadshow, which brought together local providers, MHSS ourselves, to deliver cross-cultural sexual and reproductive health training in Mildura, Robinvale and Swan Hill. This was an absolute standout, and I think anyone who was engaged with that could attest to that. We've delivered both community and workforce sessions, and in Mildura we had exhausted some of those sessions. So there is a real appetite for this type of work, which is exciting. And of course, our STIS test vending machine, which you can have a play with here at the conference. It's down where all the coffees are. We're really proud to have, it continues to evolve and grow, and we've dispensed over 280 test kits, which is great. And what's kind of most interesting about this is 67% of our users are reporting to have either never tested before or not tested in the last 12 months. So we are getting quite a good cohort accessing that service that obviously we can't unpick too much yet, but why are you not accessing mainstream services? Is it an accessibility thing? Is it a privacy thing? So STIX is still growing, expanding and seeming to hit the mark. We are really working on the next 12 months though on trying to get our return rates up. However, it's always wonderful to obviously celebrate our successes, but I'm sure we all know these are milestones and kind of not our end point. The data still tells us that where you live impacts your access to sexual and reproductive health care, the quality of the services, and your ability to make informed choices about your body and health. For rural and regional communities, this is not a new challenge, but it's persistent. Fragmented services, stigma, and distance, of course, are all things we're trying to close those barriers. So when we were asked to shape our 2026-2031 strategic plan, we went to our rural partners and said, what should SERSH keep doing? What are we missing? Where are the opportunities? The answer was fairly clear. You're meeting our needs, but we want more. We want more training, more health promotion, more connection. And this affirmed for us that we had a strong foundation, but we also had to challenge ourselves to go, how can we reach, grow and deepen our impact? So we reframed the conversation. We wanted to look at what if we didn't just respond to the poor sexual health issues, but promoted lifelong sexual wellbeing? How can we do that? What if we focused on systems that help people stay sexually healthy in the first place? So how can we get a shift towards that? And I think our work will never be done until we see this. Being born in a rural and regional area should not determine your sexual and reproductive health outcomes being a reality. And that's the end goal for our job, isn't it? You want to do yourselves out of a job. So that's where we've landed, continuing to deliver practical, responsive solutions while sharpening our focus on prevention, equity and sustainability. And of course, at the heart of all our work is the dedicated, skilled and resilient rural sexual health workforce, many of you in the room today. You continue to deliver care under pressure, you innovate in tough conditions and build trust where it matters most. This plan is about backing you with training, collaboration and system level support. So that's what we can do. It's ambitious, absolutely, but look, we have to have something to work towards. A future where rural communities and the workforce that supports them have everything they need to achieve strong and sustainable outcomes. So that's why our vision is unapologetic and very clear. We want empowered rural Victorian communities with equitable access to high quality sexual and reproductive health care, support and information. And of course, our mission makes this a reality. So in terms of our priorities, these should ring true for what you know kind of traditionally the work for SERSH, with just a slight expansion and reach. So building on this foundation, our priorities guide us to bring this to life through excellence in rural workforce development. So we'll continue to strengthen the rural workforce capacity and retention. We're going to place a real strong focus on how can we keep people in these roles, how can we make sure they're not burnt out. We'll also be taking a whole of life course approach to who this workforce is. Who are the people in our rural regional communities across the life course that can have a touch point with our community that influences outcomes? What role can early years play? What role do our youth workers play? What role do our health services play? What role do our local governments play? What can we influence across the whole life course? Impactful collaborations and networks. We're really working towards embedding sexual and reproductive health into the broader public health system. So that'll be through our partnerships, local government, our Aboriginal controlled organisations, hospitals, public health units, community health services. What we really want to do is shift sexual and reproductive health from being a siloed issue outside of the health and wellbeing conversation and make sure that any time health and wellbeing is being discussed, sexual health is part of that conversation. Ideally one day that we don't have to keep pushing and it's just recognised, but at this point in time, we have to proactively put it on the agenda in all these conversations. Trusted leadership and responsive support, grounded in evidence and focused on what matters. We will use our data to foster learning. We want to inform system responses with this data, and most importantly, we want rural perspectives to shape policy and programs. So we're making an effort to make sure there's rural data captured, and then that data is actually showcased in form and shape, not just captured and sitting on a shelf. And of course, innovative, practical and community-centred initiatives underpinned by equity and community-led change. So this sharpens our focus on inclusion, equity and structural change, ensuring these efforts are driven by and accountable to the very communities we serve. So I won't go through this, but this is kind of the key takeaways around what you'll see from us moving forward. We're very aware it's ambitious, but we need to make our money stretch, and we know that with the finite resources, the way to do this is still provide those practical solutions on the ground, but also really push towards systems change across communities. Thank you again for being here today. I can't wait to see what the next chapter holds for SERSH and our partnership with everybody else. And now it is my great pleasure, because I'm aware that it is me between our plenary speaker, to introduce our first plenary speaker for this morning.